Welcome to our YouTube channel. My name is Jessica, and today I am hosting one of the international nurses here in the UK who is going to help us understand more about working night shift and day shift as a nurse in the UK. Welcome him to introduce himself and tell us more about the UK.
Yeah, my name is Jimmy Homaset. As you said, I'm a staff nurse here in the UK, originally from Kenya. Yeah, I'm happy to be here today to discuss more about working night and working day. Yeah,
yes.
So yeah.
So how has it been, like, as an international nurse here? How has it been?
Been okay. A wide range of experiences, of course. And a couple of things to compare between here and home, differences here and there, similarities here and there, but all in all, we are in a new environment and have to adjust and keep going.
Yeah, I agree with you. Yeah. And how long have you been working as a nurse here in the UK?
I came to UK July 2022. That makes it 2 years and 2-3 months.
Okay. So does it mean is it now you are able to decide what shift do you want to work?
So I don't decide which shift I work. The ward manager allocates when balancing whatever shifts allocation, the way they do skill mix and so on. So they balance, the ward manager allocates basically. But I'm allowed to do a duty request. I can do a duty request. If I show you the duty roster, it allows me to request, like, is it 3 shifts or so request in a month? It is 3 or 6, one of those, because they usually give in 2 months you can request 6. If I'm not wrong, that's it. So you can just request, but you can't choose your day or night. However, some people can request to work day or night based on their personal circumstances. There are people who have issues like childcare.
Yeah.
They can request maybe night shifts only because their partners are working day shifts, and they can take care of the child or something, so that when they work at night, so things like that. Other people have health issues.
Yeah.
And the circumstances differ. Other people are students at the same time working. So depending on your factors, you can just explain to the managers and they allocate you shifts depending on the situation. The good thing is that here in the NHS, the NHS is accommodating to all of us, like accommodating. If you explain yourself very well and you're not lying, as long as you're not lying, they understand you, and you'll be sorted. I have colleagues who are working day only, others night only, and people like me who have no really specific circumstance. So I'm happy to work both day and night, and it doesn't affect me at all. Your other question was whether I prefer day or night. I don't really know whether I prefer day or night. However, I think I'm having trouble waking up earlier. I'm not an early riser. Waking up in the morning I don't like.
Yeah.
And then in the day shift, there usually I don't know really, but I think there is quite a lot happening in the wards during the day. So I just, part of me doesn't like working day shift at all. Unfortunately, night also it's not easy to get help. So but again, I like working night. So I can't answer that question very well whether I like working day or night, but I'm just happy as at now working a mix of both.
I think I can help you answer that well, maybe give you another question. In terms of responsibilities, do we have more responsibilities during night shift and less during the day, or vice versa? Or, just explain about responsibilities during the 2 different shifts.
Yeah, I think this particular one depends on the department where you're working. So I will answer in relation to my own department. So during the day shifts, I think that's where most procedures take place. A lot of doctors come to see patients. Patients need to go for procedures, CT scans, MRIs, and so on. So preparing the patients, the doctors are here to review the patients. They need to do a lot of blood work, a lot of work. So I think there's a lot going on during the day that doesn't go on during the night. So during the day a lot happens, so there is too much work in the day,
and that's the shift you don't really like.
So at night, what complicates issues is just if you have a patient who is deteriorating or things like that. So if you get a deteriorating patient, you have to stay there, and spending more time in one patient deprives you from the time you would have used to attend to another patient. So you have more work waiting for you, less time. So you end up, being stressed and so on. I've been there.
Your mind or
I've
something.
I've been there many times. I've been there many times, and I've been there many times, and it's challenging sometimes. So during the day, you can get help. There are nurses in there. You can call help from the next ward. Even the ward managers are there, happy to help. The sisters are there. But at night, 3 nurses only. 33 patients or 34.
Okay, so the workload is a bit high during night shift compared to day shift.
Yeah, sure. Yeah. Okay. So you can see that.
Okay. Yeah. And what about the availability of probably helping hand like HCA, and people to help, like healthcare assistants, are they there during the day and night as well?
Just the same thing I'm saying, like during the day, I think sometimes we have even students extra hands,
Okay.
But and the ward managers are there. Like my ward, for example, have 2 of them, and you can have there are more people to send if you need something during the day. There are sometimes students, they increase our number, HCAs and so on. At night, you can get it's me and 1 HCA and my 11 patients.
Oh,
you see?
Okay.
And the other thing is, the HCA can only do HCA work.
Yeah.
As a staff nurse, what a nurse can do, only a nurse can do.
Only nurse can do.
So it is a point where even if you give me 10 HCAs and the nursing work remains the same, I have to do that. The responsibility lies solely with me. So basically, their presence, as long as I'll give you my example for me.
Yeah.
I need the HCAs just to help me with like fluid balance, skin maps, and just ensuring the patients are comfortable, and I'll do the nursing work.
Okay.
In a situation whereby I only have 1, let's say about 2 cannot even help with the observation, and I have to do all those other things by myself plus the nursing work. I realize I have a lot to do, and if you're in a situation of where my workplace now, my workstation, for example, I have patients with the PCAs, and I have fluids, I have too many things, and it's at night, and it's just too much sometimes.
Yeah. So does it mean night shifts probably you get more pay compared to day shift?
It's not about more pay, but there is something called night enhancement.
Okay.
Whereby there is a little more than the usual hour pay, for the night.
Yeah.
So for example, I've forgotten the percentage, but it's something like, it's not the realistic figure, but it's something like 20% more. So if during the day I'm supposed to earn 13 pounds per hour, in the night it could be something like 15. So I'm not sure the exact percentage, but there is usually something a bit more.
Okay.
If you look at your pay slip at the end of the month, they will calculate night shifts enhancement, Saturday enhancement, and Sunday enhancement.
Okay.
So if you worked 6 night shifts, you will see 6 times a particular number.
Okay.
I wish I had my pay slip. I would have checked the exact figure, but there is usually a bit more, a smaller percentage, really, maybe 20 or 25 or that. I don't know the exact one, but yeah, there is something a bit more. Okay. So yeah, for the people who are, if you feel like you want to get a bit more, some extra coins, you can request more nights. If you're happy to work nights, request more, and you can enjoy a few extra coins. Yeah.
Yes, I have also had you mention about Sunday, like the payment for Sunday and night shift are.
Sunday is the highest paying in terms of the rates.
Oh,
working
okay. So people should not go to church.
So I prefer working. I prefer going to church on Sunday than going to work.
Yeah, should be like that.
So I prefer that. But we are nurses, and the patients, we need to take care of them. So when you see me going to work on Sunday, it is not my choice. I've been allocated that one. But I told you earlier that you are usually given a chance to request duties.
Yeah.
I usually request off duty to be off on Sunday.
On Sundays.
I usually request to be off duty on Sunday so that I can rest at home, go to work. By the way, I don't like working Sunday, day or night, and Monday. I don't like working.
Yeah.
I prefer being off duty Sunday and Monday.
Okay.
And I think if my manager will watch this somehow,
you should take note of that.
let me be off duty Sunday and Monday. But I'm happy to work night on Monday. But I don't like working Sunday day or night, and Monday day especially. I don't like those particular hours. Any other day I'm happy. Yeah, but it's true that Sunday pays more.
Yeah.
And Saturday, it's called what do they call it? It's called something unsocial hours or something like that for the night shifts and enhancement. Weekend enhancement Saturday and Sunday, day and night, then unsocial hours enhancement for night shifts. Yeah.
So what advice would you probably give to any overseas nurse or any overseas nurse who is probably watching you right now, and who is about to relocate to the UK and is looking forward to either working day or night shift or working both? What advice would you like to give them?
I think the initial days it's very important to work day only, and actually, you will not even choose this. Once you report especially to the NHS, you will work day shifts only for quite some time so that you understand how things work. If you come straight to the nights, not too much. There is not a lot. There is a lot that doesn't happen at night that happens during the day only.
Yeah.
So you need to work day for quite some time. Understand things that happen. You cannot be doing there's some competences which you're gonna do at night. So you need to do during the day only. So you need to work a day for quite some time, understand how things work, consult people. The ward managers are there to help during the day shift, the sisters are there, consult a lot during the day, see how things are working, take patients from one place to another, understand the corners of the hospital or the facility where you will be before you are able now to come back and work night. I think myself, I stayed like how many months? I reported the ward in mid-August 2022. But the first night shift I worked, I think December.
Oh.
Yes, December 2022.
Wow.
So like 4 months later.
Wow.
Yes, 4 months later. And after when I qualified as a nurse, when I finally got my PIN, 1 month, I didn't work night for a month.
Okay.
Yes. I was doing just competencies and so on. About a month. I was working day shifts only before now I came to start working nights then.
Okay, thank you so much for that. We could be having any parting shot as we conclude this interview. What would you like to?
UK is good. Those who are coming, those of us who are here, let's keep working, keep grinding, keep giving our best. Those who want some extra money, request for those night shifts, request for those weekend shifts. Those have some extra cash, Those of us who are coming from overseas, money is one of the top priorities. So get those night shifts, get the weekends, get some money. But again, report if you have any preferences for day or night shift, or if you have an health issue or anything that you feel will make you to perform better. Tell your ward manager. They'll be flexible with you. Especially if you're in the NHS, it's very accommodating really, and they understand you really most times. Very few situations will hear someone who is not understood. But if you have really a genuine circumstance, go and tell your manager. They'll accommodate. If you are someone who is sleepy, you just know you'll sleep during the night shift. Please don't even go there. Actually, one of my friends, we used to work nights together. When he qualified as a nurse, he came after me. And sometimes I realized he's not working night these days. Then I asked him what happened. He told this ward manager that he can't stay the whole night properly. If he is falling asleep after 10 o'clock and he can't just work. Guess what? after just genuinely expressing himself to his ward manager, and the ward manager understood the guy and just gave him day duties only.
Wow.
Now he's happy to come to work during the day and go home, because he says by the time it is 10 o'clock he's gone. He's gone, you know. So as long as you don't lie, these people are open to understand you. Just express yourself better and let's enjoy working. Let's keep grinding, keep pushing, keep pursuing goals, keep going for it, and let's keep building this nation.
Yeah, we keep on pushing harder and harder. And guys, we are really grateful for your time, for watching, for listening. Maybe you are a nurse here in the UK, and probably there are some things that we've missed out. You can sorry for interrupting. I've remembered something. There is some other departments which, when you work, you only have the choice of a day shift only. Okay.
There's some departments like discharge lounge, department like the outpatient clinics. Like if you get yourself on the ENT outpatient clinic, breast clinic, not dental. You see the specialized clinics, they only operate day shift only.
Okay.
So if by any chance you get yourself working there, you only have one option, day shift only. Even some theater staffs, day shift only up to 9 o'clock. However, there's some other theater staff. I have 2 colleagues who have very unique shifts that I don't understand. They work from 4 o'clock to midnight.
Okay.
Yes. So there is some unique shifts. As I said earlier, some of them depend on the department you'll be working. Some are day only, but some job advertisements, when you look at them, they say night only.
Okay.
Night only. They can say staff nurse night. They want someone for night specifically.
Okay. So by the time you are applying for this job, you are psychologically prepared that it's a night only.
There's another one you can see, like they say 8 to 8 a.m. 8 a.m. to 8 p.m. shifts only. So you read that one, you understand. Even if it's a 24-hour department, but your particular role could only be an 8 to 8. That's different. But if you get yourself the clinics or that kind of situation, just know it's 9 or 8 to 4 or to 10. And the specialist people, the specialists, diabetes nurse, those kind of nurses, chemotherapy, whatever, they only work like 8 to 4 or to 5, around there. So it's different. It's not, I only spoke in my context, but other departments work differently.
They're unique.
That's it. That's what I wanted to say.
Okay. So thank you very much, our people, for watching, for being with us for that period of time. And probably you are a nurse in the UK, and there's some of the things that we could have missed out. Maybe you can drop you a comment on the chat box. Comment section, I mean, sorry, comment section, and tell us more about night and day duties. So with that, we'd like to wish you the very best as you look forward to joining or to relocating to the UK if you're looking forward to. Thank you very much. I was your host, Jessica, and have a blessed time. Thank you.